I'm Dr. Rodney White with Sapi Chiropractic, and today I want to help everyone understand low back pain a little bit better, especially when it involves disc injuries and disc herniations, because there's some huge misconceptions out there, and often the wrong choice of treatment gets made because of this. So low back pain, it affects a lot of people. It's estimated about 80% of all adult Americans will have at least one severe episode of low back pain throughout their life. And unfortunately, a lot of people deal with it on a very chronic basis. It's just there all the time. It gets better or it gets worse. And then worse off after that, we get told there's a slip disc or a disc herniation, and everyone that hears the disc word usually panics, and they shouldn't. So let's look at it. Low back pain, about 90% of it is actual mechanical stress, meaning there's some kind of alignment issue or micro trauma, repetitive injury, or even a major injury, and it's put a lot of stress on the low back, the joints, the tissues. That almost always can be helped with conservative care such as chiropractic. And if you don't have a good chiropractor, or you've been a little nervous to try one, then head over to sapicchiro.com. You can click on the yellowy gold looking button that says new patients, click here. That'll take you to a page where you can fill out your information. We offer a complimentary consultation, so it costs nothing at all for you to meet one of our doctors and see if we're the right place for you. So if you've been told you have a disc injury, here's the things you need to know. So that 90% of low back issues are just mechanical stress. About 2% are what we call a red flag. Bone infections, fractures, things like that. The other 8% to about 10% will be actual disc injuries and disc herniations. So let's run through how these things happen and what each classification is. So the disc sits between our vertebra. It's a shock absorber. As we move and stand and go about our life, we have force come down, the disc squeezes and takes all that pressure. If we have an alignment issue, so I'll show you on the spine here. Here it is showing the disc bulge. So normally our spine will be straight like this. If I greatly exaggerate and tilt you to the side like that, you can see where the disc is going to bulge out. That's because the disc works just like a balloon. If you squeeze one side of a balloon, the other side expands. The discs are designed to do this. They're built to handle this. So when you just have a disc bulge, all that's happening is your disc in your body is transferring the weight and the stress to protect you. That's a good thing. It's designed to do that. And about 70% of people who have no back pain have at least one disc bulge. So anyone who has a disc bulge needs to go and see a chiropractor, get everything assessed, get worked on, get the stress to fall much better with center of gravity, and the pressure will come off that disc. And a lot of times the disc will either resolve itself and suck back in, or at least enough pressure will come off that the pain will go away. The problems kick in when that disc is bulging and there's so much pressure that it causes some of the outer layer to tear a little bit. Then we get what's now called a herniation. These usually will put pressure on the nerve and pin them against the bone at the back, and that can cause all sorts of symptoms. Down in the leg or the arm, if it's in your neck, we can get numbness, tingling, pain, weakness, muscle wasting. Even with most disc herniations though, surgery should only be done on a very small percentage of them. The majority, again, should have conservative care first. If you have a serious disc herniation, our recommendation is chiropractic care and physical therapy, and most people will bounce back really well. When going to the chiropractor, you want to make sure they're not too rough on it and not too many twisting motions. When you have a disc herniation, it's not ideal necessarily to be placed on your back, on your side with the leg coming over, if that chiropractor is twisting you quite aggressively. We don't use that adjustment when we're dealing with discs. We use a different style that's much more comfortable on it. If you feel like you've tried everything and you've tried chiropractic, you might want to have a second, third, fourth attempt with different chiropractors, because if one of those can get the right adjustment on it and save you from surgery, it's well worth it. Because once you get surgery on a disc herniation, even if they just do a slice of the disc, you're now 3 to 5 times more likely to need a fusion later in your life. So you want to try and avoid that at all costs. And if you've tried physical therapy alone, that usually won't help without a chiropractor also helping get the stress off that spine. Then the physical therapist can work their magic and try and retrain those abnormal movement patterns. So hopefully that gives you a little more knowledge on the issue. I guess there's one other little thing that can happen with the disc. Those herniations can actually break and you can have a piece of disc floating around. Those almost always need surgery because they get caught up in the joint. And a couple red flags you want to look for if you do have a disc issue. If it's in your low back and you start to lose control of your bowel or bladder, that is an emergency. You need to go to the ER. It doesn't mean you'll definitely need surgery, but that needs to be assessed by a neurosurgeon immediately. Also, if you're noticing significant muscle wasting, you need to get to a good chiropractor or a good surgeon ASAP to be assessed. A good chiropractor, if they're worried about it, will then send you to a surgeon. But once that muscle is wasting away, that's also what we call a hard neurological sign. Anything less than that, pain, tingling, numbness, mild weakness, the first point of call should be a chiropractor. Get assessed, see if they can help you. If you try one and you're not getting any success, don't give up on chiropractic for that issue. Try multiple and get different points of view on it first. And again, if you haven't got a good chiropractor or you want to try someone else, we'd be more than happy to assess you. There's no cost to come and meet us and see if we're the right fit for you. Our website is sapicaro.com. We'd love for you to check it out, and we'd be more than happy to meet you and see if we can help. That's all we have for today. Hopefully this video has been of value. I'm Dr. Rodney White with Sapi Chiropractic. We'll see you next time.